When should I worry about an infection after surgery? Imagine waking up after surgery and feeling fine, but then noticing something unusual in the next few days. It's normal to be cautious about infections, but knowing when to worry can make a big difference. A surgical site infection happens when germs sneak into the area where you had your operation. These germs can cause redness, swelling, or pain that gets worse instead of better. Most infections show up within the first 30 days after surgery, especially if stitches or staples are still in place. Keep an eye out for signs like increased redness spreading around your wound or swelling that feels hard or warm. If the pain becomes more intense or the wound starts draining pus or cloudy fluid, that's a red flag. Sometimes the fluid might have a bad smell. Also, if the skin around the wound changes color or the wound looks larger, it's time to be cautious. A fever is another important sign. If your temperature rises above 100 degrees Fahrenheit and stays there, it could mean an infection. Feeling very tired, chills, or feeling generally unwell are also signals that something isn't right. If you notice any of these symptoms, especially if they are worsening or not improving after a few days, contact your healthcare provider. Severe pain, redness that spreads quickly, or pus that is thick and yellow or green need prompt medical attention. In some cases, you might experience confusion, rapid heartbeat, or trouble breathing, which requiring immediate care. Infections can be superficial, affecting only the skin, or deep, involving muscles or internal organs. Deep infections might not look obvious on the skin but can cause serious pain, fever, and feeling sick. These often need imaging tests like ultrasound or scans to diagnose. People with diabetes, a weakened immune system, obesity, or those who smoke are at higher risk. Longer surgeries or certain procedures also increase the chance of infection. Your surgical team considers these factors before and after your operation. To help prevent infections, keep your wound clean and dry. Follow your healthcare team's instructions carefully, including how to change dressings and when to avoid getting the wound wet. Watch for signs like redness, swelling, or pus, and report any concerns right away. Don't ignore symptoms hoping they will go away. Most infections are treated with antibiotics, and sometimes the wound needs to be opened to drain infected fluid. In rare cases, another surgery might be needed to clean out the infection. Early treatment usually leads to better results. After surgery, check your wound daily. Take photos if you're unsure what you see. Keep a record of your temperature if you suspect a fever. Always wash your hands before touching your wound and avoid applying creams unless your doctor says it's okay. Remember, you should worry about an infection if redness, swelling, pain, pus, fever, or feeling unwell increase. Contact your healthcare provider immediately if you notice these signs. Recognizing problems early helps prevent serious complications and speeds up your recovery. Follow your care instructions closely and ask questions if you're unsure about anything related to your wound.